Namaste viewers, welcome to Sri Anantha YouTube Channel. Swamiji, could you please tell us about the first element of the central nervous system?
Embodiments of love. In today's episode, I am going to share with you the first ailment of central nervous system called neurological degenerative disorders. It encompasses a range of conditions that affect the brain and nervous system, leading to progressive deterioration of neurological function. These disorders can have a significant impact on person's quality of life and daily functioning. Stroke is a common neurological degenerative disorder caused by disrupted blood flow to the brain, resulting in brain cell damage. It can cause various symptoms including speech difficulties, paralysis, or weakness in parts of the body and cognitive impairments. The second case is Alzheimer's. Such a disease, another prevalent disorder, primarily affects memory and cognitive functions. It involves accumulation of abnormal protein deposits in the brain, leading to the gradual loss of brain cells and mental abilities. Third case is Parkinson's disease. Is a chronic and progressive movement disorder caused by the degeneration of dopamine producing cells in the brain. It manifests as tremors, rigidity, slowness of movement, and difficulties with balance and coordination. And MS, what we call multiple sclerosis, is an autoimmune disease that affects the central nervous system. It occurs when immune system mistakenly attacks the protective covering of nerve fibers in the brain and spinal cord, resulting in communication problems between the brain and the rest of the body. Symptoms can include fatigue, muscle weakness, coordination problem, and cognitive impairment. And amyotrophic lateral sclerosis is also there, which is called ALS, is a progressive neurodegenerative disease that affects nerve cells in the brain and spinal cords. It leads to muscle weakness, paralysis, eventually respiratory failure. Then traumatic brain injury, in short form we call it as TBI, refers to any damage or injury to the brain caused by the external force. The severity of the injury can result in range of physical, cognitive, and emotional impairments. Meningitis is an infection that causes inflammation of protective membranes surrounding the brain and spinal cord. Symptoms may include severe headache, fever, stiff neck, and sensitivity to light. Epilepsy is also one kind of a disorder characterized by recurrent seizures caused by abnormal electrical activity in the brain. The symptoms experienced can vary depending on the area of the brain affected. Huntington's disease is a genetic disorder that causes the progressive degeneration of the brain cells. It leads to motor, cognitive, and psychiatric symptoms including involuntary movements, coordination difficulties, and cognitive decline. Hence, these neurological degenerative disorders highlight the complex and diverse range of conditions that affect the brain and nervous system. So, proper diagnosis, treatment, and management are crucial in helping individuals affected by these disorders maintain their quality of life and function to the best of their abilities. So, in our next episode, I will come up with the developmental disorders, central nervous system developmental disorder. So, as of now, we have seen these whatever the degenerative disorders, how it have the impact over the people, and not only that, if any blood cells gets clots or due to multiple sclerosis or due to autoimmune system, whatever may be the conditions, all this leads to neurological degenerative disorder. So when I will come in the next episode, I will discuss with you regarding the developmental disorders that also have very great impact right from the childhood of a baby also. So regarding that, we will discuss in our next episode. Till such time, stay blessed, have a good day, God bless one and all. Om Sai Ram.